As the development of modern medicine, coronary stent is understood by more and more people, and it benefits about 800,000 people in China every year. This video introduces the whole process of coronary stent catheterization based on the coronary stent surgery of live patients. Voiceover: patients only need local anesthesia in the wrist or leg as a relatively small cut. They are awake in the whole surgery process, and some cheerful patients even talk with the surgeon occasionally. Any discomfort during the surgery can be told to the surgeon immediately. Open the package. Prepared medical devices for PCI surgery, including introducer set, introducer sheath, dilator, guide wire, indwelling needle, etc. Disposable pressure transducer, dose control syringe, manifolds, angiographic guide wire, angiographic catheter, etc. Disinfection. The right radial artery is the most common choice for implantation of coronary stent. Roughly disinfect the arm before surgery, then wrap it to ensure the surgical table is in a sterile state. Local anesthesia and puncture. Inject appropriate anesthetic to contact local anesthesia. Aim at a puncture site. Use an indwelling needle to insert into the site at an angle of 30 degrees with the arm. After puncture, withdraw the needle and maintain the catheter in place. Then slightly pull back till see blood backflow, which means success of puncture. Insert puncture guide wire slightly and slowly to avoid it goes into vascular dissection. 3. Establishment of channel. Remove the indwelling needle. Insert introducer sheath and dilator along the puncture guide wire. After that, withdraw the guide wire and dilator and maintain the sheath in vessel as a channel for subsequent insertion of guide wire and catheter. 4. Angiography. Insert angiography guide wire and angiographic catheter into vessel through the sheath. The guide wire is a flexible and steerable device which can be operated by physician to pass through a complex vessel and retrograde from radial artery to great vessel and aorta. The angiographic catheter shuttles in vessel along the guide wire till it reaches near coronary artery. The physician makes use of the fluoroscopy to determine whether the angiographic catheter has reached the accurate place or not. Withdraw the guide wire after the angiographic catheter reaches the coronary artery. Then connect angiographic catheter with manifolds, and the ports of manifolds respectively connect with a disposable pressure transducer, heparin saline for anticoagulation, and contrast media for angiography. During this process, the physician needs to use fluoroscopy to capture the condition and inject contrast media through the catheter. This special liquid can show the thickness and direction of blood vessel under X-ray to help finding the occlusion lesion site, which is normally called lesion vessel, bringing occlusion. Use dose control syringe to inject contrast media to confirm whether there's lesion or not, based on the vessel shape displayed on computer screen under fluoroscopy. After confirmation of lesion vessel, withdraw angiographic catheter. 5. Dilatation of PTCA balloon catheter. Connect the guiding catheter and Y hemostasis valve. Insert angiographic guide wire into guiding catheter and hemostasis valve. Open X-ray machine to confirm the position of guiding catheter and place it in the coronary mouth. Insert guiding guide wire and confirm the position by X-ray machine. Rotate torque to direct the guide wire go through the lesion site. After that, prepare PTCA balloon catheter and insert it through the guiding guide wire to lesion vessel. After the PTCA balloon catheter reaches the target site, physician pressurizes the balloon by an inflation device to dilate the lesion vessel and construct a channel for placing stent. After dilatation PTCA balloon dilation catheter, Pull the inflation device to exert a negative pressure to flatten the balloon and withdraw the catheter. The above process should be operated by experienced and skilled physician. 6. Implantation of stent. Use guide wire to advance the delivery system, balloon catheter, and stent. After pre-dilatation of the balloon catheter, intravascular plaques are extruded close to the inner wall of the vessel and make the balloon catheter and stent go smoothly to reach the targeted place. Then use balloon inflation device to pressurize the balloon catheter and dilate the stent. After dilatation of the balloon, the stent will be shaped like a net. 3 pictures from left to right respectively shows the gut end of the balloon catheter and stent, balloon and stent dilatation after pressurization, and stent remained in the vessel after removing the balloon catheter and guide wire. For the computer screenshot, the red area shows the narrow vessel gets wide after implanting stent and the blood flows through normally. In order to avoid reocclusion and reobstruction after stent implantation in recent years, the new generation of stent is covered a coating of medicine on the surface, which extremely reduces the rate of occurrence. 7. Post-dilatation of stent. Use guiding guide wire to deliver NC coronary dilatation catheter, post-dilatation catheter to redilate and shape the stent. After post-dilatation, the whole stent is extruded close to the inner wall of the vessel so as to avoid or reduce the risk of postoperative thrombosis. After that, inflate the balloon catheter and withdraw it together with guide wire and guiding catheter from vessel. Tourniquet plasmin. Clean the blood around the arm. Withdraw part of sheath and place tourniquet and pressurize it to compress sheath, and then remove the sheath and adjust tourniquet to a proper pressure. Fixing the tourniquet. The above is the main process of coronary stent implantation.